Hi guys, welcome back to Rts Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, thank you everybody for tuning in last week with my co-host JJ, the respiratory therapist. He was an amazing co-host. We had a blast, and I hope that if you guys like those segments, I hope to continue to do stuff like that where I'm speaking to other respiratory therapists that are doing big things in the field and in entrepreneurship. All right, so we call those folks RTpreneurs. Well, I do anyway. All right, so yes, thank you to anybody new joining us here today. Just remember that we are here. Rts Share Tea is here every Wednesday on Google Podcasts and every Thursday on YouTube, 6 p.m. Eastern Time. All right, guys. So know that we are growing together. All right, guys. And there's so much more content to come. Okay, so today's episode is we're going back to talking about health education. So for those folks who are new to me, I am a registered respiratory therapist that started at a level 1 trauma center. I one night got a 5-year-old child who died from asthma because the grandmother did not know he was having an asthma attack. This broke my heart and changed my life forever. Changed my whole entire career. I became a certified asthma educator. I started managing asthma programs, and now I am the director of an asthma program in North Brooklyn. Okay, so that is my story. So I know quite a bit when it comes to promoting health education programs and how to make these things move, executing work plans and working on deliverables. And these are terms that may not be familiar to most respiratory therapists if you are not coming from that field, right? So today's episode is basically talking about selling health education programs, right? So selling anything is a skill. Okay, so it is a skill. So, and selling health is not particularly easy. It's not an easy sell. It's not like the iPhone. It's not something, health is not something you can touch. Okay, you can't grab it, right? So it is, you have to know how to sell it. So when we speak about health education programs, we are talking about things like diabetes programs, hypertension programs, and asthma programs, okay, which is, like I told you, my bread and butter. Okay, so how do I break this down? Health education is a part of preventative care. So preventative care is like your screenings, your annual checkups, your going to get your medications reviewed, so stuff like that. And what's a part of that is the health education. So health education empowers the individual or the community through education and influencing the attitude towards caring for their well-being, right? So we want to make sure that the behavior is changing positively in this direction, right? So that's pretty much what health education embodies, okay? And so when it comes to selling this, right? So I'm going to go over a few things that makes selling a health program, a health education program, successful. Okay, so number one, you yourself have to feel empowered and confident to promote a health education program. So what that means is you have to know what you're talking about. And you also have to believe that health education is necessary. You have to feel like the information I'm giving you is saving your life. Okay? So I'm not talking about handing a pamphlet. I'm talking about really it's coming from your heart. Like, I believe it's coming from your heart. It's coming from your gut. I believe that I am saving your life by giving you this information, by giving you these resources right here, right now. So that helps sell the program. Okay, so that is number one. Number two, you have to know the community you're serving or trying to serve, right? So we have something called a needs assessment in the health promotion, health education world. A needs assessment, basically what we're saying is you're seeing what is the gap between what a community has going on and what should be going on, right? So the differences, what are the discrepancies between these two things, and you're identifying the gap. And so that is a needs assessment. So basically, this is done through data, through research, but you can do this by taking a stroll in the area of where you're trying to serve, right? So you can't be scared of the neighborhood or the community you're serving. And this is something that I don't quite understand when folks they take positions like this. Okay, so you cannot just be running outside to go get your coffee from Starbucks and hurry up and come back inside and go and sit in your desk or in the hospital or whatever. You have to get out there and get to know the community. Take a stroll, see where people are shopping, see what they're doing, see, like, what their needs are, and you can do this by simply going outside. Yes. Okay. Find ways. Number 3, you have to find ways that you relate to the community you're trying to promote the program to. So ultimately, people, and you're gonna hear this when you sell anything. People like to buy from folks that they trust and that they feel relate to them, understand them. So understand why all these businesses want your information, data, and data sharing, and all these things, is because data equals dollars, right? So your data is very important because they want to get to know you. So in order to sell anything, I have to know you. I have to know where you live. I have to know what you into. I have to know when's your birthday. You have to know. So I have to be able to relate to you to sell something. So if I'm trying to sell you to enroll you into a program, number 1 is, can you relate to the community that you're serving or trying to serve, right? Another thing is number 4. You have to display what you plan to offer in the program boldly. So right away, no read between the lines. What does this program offer? Right? Loud and clear. Keep it simple. Keep it clear and concise. Like, no need to put extra. I'm going to show you. I'm going to put this up in the end. So this is a flyer that I created real quick for our home environmental assessment case management program for asthma patients. So look, you're going to see the word free. The word free is everywhere. Does your child have asthma? Free everywhere. What you're getting. And I even have a picture of what you're getting at the end. All right. You have to know the community that you serve. My community, they like free stuff. They like stuff for free. All right. Just keeping it real. So know what the community you serve, what they need. All right. So number 5. I just lost my train of thought. Oh, number 5. You have to network like crazy. All right. So when it comes to health education program, this is not something you can do behind your desk. Okay, it is not one of those you just sending emails, meet and greets through email. You have to actually get out there and promote the program. It's not a one-time hit it and quit it type thing. You have to go out there. You have to be with other programs, other community-based organizations. You have to be with other institutions. You have to network with faith-based organizations. You have to be involved in others' meetings, committees, and whatnot, in other hospitals to sell the program. So folks are they know about the program, the services that you provide, and they have a face, that goes with it. Hello. You know what I'm saying? So this is why I know what I'm talking about, because I am the program. So boom, I have to just be able to just turn on, right? And number 6. Oh my God, what number am I up to? Number 6. You have to deliver and execute the service as well, right? So just like anything else, any other service, anything that you're selling, if the product or the service is good, folks will talk about it and they will refer it to other people. They'll be like, hey, listen, the asthma program really helped out my kid, helped out Johnny. Hey, you know what I'm saying? Maybe you should think about checking them out. I'm telling you. So this is how you start your own referrals through word of mouth. You're not chasing folks anymore to enroll into these programs. They are coming to you. All right. So understand how this works. So make sure that what you are promising, you are delivering, and even better, go beyond that. And folks will talk about you in a good way. We'll talk about the program, right? And understand that you can create some type of bi-directional referral program with other organizations, and you can give family members or individuals that did enroll with your program, you can give them incentives, such as giveaways and stuff like that, to let them know, hey, listen, spread the word and we'll hook you up. All right, guys. So I hope you guys learned something today. Anybody that is interested in going towards leaving acute care, know that this is another good opportunity for respiratory therapists and those that want to go into the public health field, and you want to connect with patients on a community level, and you want to impact lives, in this matter. So thank you guys for listening to me today. And once again, remember, we here every Wednesday, 6 p.m. Eastern time, and every Thursday on YouTube. Please remember to like, share, and subscribe. Thank you so much for supporting me, guys. And remember to invest in yourself and to only compete with yesterday's version of you. Bye.